Welcome to the Health, Balance, and Wellness channel, your oasis of peace. Every year, thousands of people suffer a heart attack while alone, with no one to intervene. In these moments, the difference between life and death can depend on how well you know the warning signs and the correct actions to take. Often, the symptoms of a heart attack aren't the dramatic ones you see in movies, but subtle and deceptive ones that can easily be mistaken for something else. Knowing how to recognize them and how to respond is the first step to saving yourself. Before we continue, please like the video to support our work. But let's get back to the video. A heart attack doesn't always cause excruciating pain. Sometimes it begins with a feeling of heaviness or tightness in the center of the chest, as if something were pressing from within or a weight were resting on the chest. In many cases, the person affected thinks it's a digestive problem or heartburn, especially if the pain is accompanied by burning. When the heart is struggling, it doesn't always scream. Sometimes it whispers. This happens because one of the arteries that feed it becomes blocked, and the heart pump can no longer pump blood efficiently. In addition to the classic chest pain, other, more subtle symptoms may appear. Sudden shortness of breath is one of them. You feel like you can't take a deep breath, as if there's not enough air, even when standing still. The pain may radiate down the left arm, reaching the fingers, but it's not uncommon for it to also affect the right arm, jaw, back, or stomach area, making the diagnosis even more confusing. Other important signs include cold sweats and intense nausea. This is a type of abnormal sweating that comes on suddenly, even when sitting, and represents the body's response, releasing adrenaline to cope with an emergency. It's often accompanied by extreme fatigue, a feeling of total weakness, as if all energy is draining away. When you suspect a heart attack, the first thing to do is stop all physical activity. A common mistake is trying to move or walk to feel better. In reality, any exertion makes the heart work harder, which is already struggling. Instead, remain as still as possible. Try to reach for the phone slowly, without jerking or making sudden movements, and immediately call emergency services. It's crucial to clearly state that you suspect a heart attack. This way, emergency responders can activate a specific protocol and dispatch an ambulance equipped for cardiac treatment. When calling, it's important to calmly provide the exact address, specifying the floor, stairwell, and any other details that will allow emergency responders to enter quickly. If possible, it's best to leave the front door open, but avoid unnecessary effort. Driving to the hospital is a terrible idea. Someone having a heart attack could suddenly lose consciousness and cause an accident. Furthermore, an ambulance can provide life-saving oxygen and medications en route. While waiting for help, it's essential to position yourself to relieve the heart's workload. Sit or lie down in a semi-reclined position, with your back supported and your head slightly elevated, perhaps using pillows. This position helps you breathe better and reduces pressure on the heart. If possible, slightly raising your legs can help blood flow back to the chest, but only if it doesn't cause discomfort or shortness of breath. The goal is to conserve every ounce of energy and oxygen. Even excessive talking or movement can worsen the situation. In cases of severe weakness or a feeling of fainting, bending your torso forward and placing your head between your knees can help increase blood flow to the brain, preventing loss of consciousness, which is extremely dangerous if you are alone. Immediate help can come from a medication almost everyone has at home: aspirin. This medicine prevents platelets from clumping together, reducing the formation of the clot that's blocking the artery. However, it must be taken correctly. It shouldn't be dissolved in water as usual, but chewed until it becomes a powder. This way, the active ingredient is immediately absorbed by the vessels under the tongue and reaches the bloodstream much more quickly. The recommended dose for a suspected heart attack is 300 milligrams, so 3 100 milligrams tablets or 1 500 milligrams tablet. Naturally, anyone allergic to aspirin or taking anticoagulants should not take it unless directed to do so by emergency personnel. The correct sequence is always the same. First call the emergency number, then take the aspirin, never the other way around. If your doctor has prescribed nitroglycerin, you can use it as directed. Another enemy to manage in those moments is panic. When you're scared, your body releases adrenaline, which accelerates your heart rate and increases blood pressure, worsening the crisis. Controlling your breathing then becomes essential. Inhaling slowly through your nose for 4 seconds, holding it for 2, and exhaling for 6 seconds helps activate the parasympathetic nervous system, which calms the heart. Even focusing on a point in front of you and gently blowing toward it, as if keeping a flame burning, can help stabilize your breathing rhythm and reduce anxiety. While waiting, it's also a good idea to loosen anything that's constricting your chest or abdomen: belt, tie, bra, and collar buttons. Any constriction hinders breathing and circulation. A lot of dangerous information circulates on the internet, such as the false remedy of cough resuscitation, which suggests coughing rhythmically to keep the heart pumping. This practice is a myth with no scientific basis. Coughing requires enormous effort that increases pressure on the already struggling heart. Furthermore, it can cause drops in blood pressure and loss of consciousness. Rhythmic coughing is used only in specific hospital settings, under medical supervision, and never in cases of heart attack. Beyond knowing what to do during a heart attack, it's even more important to know how to prevent it. A heart attack is often the result of years of silent damage to the cardiovascular system, caused by factors like hypertension, high cholesterol, and diabetes. High blood pressure, even if it doesn't cause symptoms, damages the artery walls every day. Bad cholesterol tends to build up in the vessels, while good cholesterol cleanses them. Maintaining a balance between the two is essential. Excess blood sugar, typical of diabetes or prediabetes, also irritates and erodes the arterial walls, facilitating the formation of plaque. Smoking, alcohol abuse, and a sedentary lifestyle further worsen the situation. Every cigarette causes a temporary narrowing of blood vessels. Alcohol, if consumed in excess, directly weakens the heart muscle. Lack of exercise slows circulation, promoting the formation of small clots. Being overweight also places a constant strain on the heart. This is why regular blood pressure, blood sugar, and cholesterol checks can literally save your life. Many rely on supplements to protect their heart, but the truth is that no pill can replace a healthy lifestyle. Coenzyme Q10, for example, can only be useful for those taking statins. Omega-3s help regulate triglycerides and blood pressure, but should be taken under medical advice. Magnesium is important for heart rhythm, but is readily found in foods like almonds, vegetables, and cocoa. A modern indicator of heart health is heart rate variability. How much the time between heartbeats varies. High variability indicates a flexible heart and a balanced nervous system. Low variability, however, signals stress and increased risk. This parameter can be easily measured with a smartwatch and improves with good sleep, deep breathing, regular exercise, and contact with nature. Finally, a crucial aspect is managing chronic inflammation, a silent but devastating process for the arteries. It can be fought through diet and lifestyle. Reducing refined sugars, white flour, trans fats, and processed meats is essential. At the same time, favoring fruits, vegetables, legumes, nuts, extra virgin olive oil, and spices like turmeric helps put out the fire within. Daily exercise and adequate sleep also reduce inflammation and heart disease risk. Every daily choice, however small, can ignite or extinguish this fire. A walk after meals dampens it. Excessive alcohol or a sleepless night fuels it. You don't need to be perfect, just consistent. Heart health is built day after day, listening to your body's signals, reacting promptly, and cultivating habits that support it. Prevention, after all, is the most powerful form of salvation. Please note that this video is for informational purposes only and should not replace medical advice. If you have any questions, please contact your doctor. If you like our videos, please leave a like and subscribe to our channel so you don't miss any upcoming content. See you in the next video.